The time is ripe for all of the stakeholders to come together to ensure affordability for patients. And my company and the rest of the pharmaceutical industry as a whole have a responsibility to help develop long-term solutions, including pricing our medicines fairly in a way that reflects the innovation and the value they deliver to patients, healthcare systems, and society. And encouragingly, there have been significant related discussions amongst policymakers here in Washington.
And I think it's important to understand that we want to make sure that our seniors and families are covered in the way they want to be covered. And we want to make sure the costs are brought down, not to their detriment, but in order to ensure that they can afford health care that they need and deserve, but also that we are balancing out the system so the plans are maybe, their incentives are realigned, the manufacturers are brought to the table, not to gouge them or anything like that, because we still want to have the innovation.
There's the proposal the President's had in his budget and the proposal from Ways and Means, from Energy and Commerce, bipartisan, to have the plans have 80% and 20% for Medicare, to try to put more downward pressure on prices at the high end. Because the biggest drivers seem to, well, there's more of us, I'm 55 now, so there's more of us going towards Medicare. I'm the end of the baby boom. But people are going away from generics, they're not adapting generics at the same level they were at the early part of it. And then these specialty drugs that are truly, when we say those, can be completely life-changing, but they are expensive.
I think when you look at Medicare Part D, this is a program that has been wildly successful by many measures. And one thing that we frequently talk about is the fact that premiums have been very low in Medicare Part D and have been stable all, in recent years. And, I think as we have watched the benefit evolve and as we have seen new medicines come to market, what we have observed is that there has been such a premium, if you will, on keeping premiums low, that we are now seeing plans essentially asking patients to pay a higher share of out-of-pocket costs.
So to follow on Lisa's comments, so I'm a practicing primary care physician. I see these issues about out-of-pocket costs every day. And I think my most tweetable soundbite, since most of the audience is often tweeters, is that Americans don't care about drug costs, they care about what it costs them. And all this discussion in this town about drug prices has failed to distinguish between what my patients pay out of pocket and what the price of various services are. And as Lisa said, we've made people pay more for all services, high and low, for the lack of a nuanced benefit design.
We have a helpline. We receive hundreds of calls a week, thousands a month, and more every year. The top question, second only to learning how to manage a diagnosis, is I need financial assistance. So just because you have insurance doesn't mean you can avoid financial toxicity. It is real, it is present, and we have to be able to figure out a way, which we were talking about earlier, to think about making sure that the right medicine is getting to the right people at the right time without a third party intervening in that process. And I think that may be a better way of trying to reformat a system, because we are in this era of a more personalized, individualized endeavor.
This drive towards value and making sure that patients in the system can get value out of the Part D program to make sure that it's working for them to get drugs that they need. There have been proposals that this administration has carried forward that have been along for a while. I think we've seen some interest even recently on the Hill related to restructuring the catastrophic phase of the Part D benefit at the same time that CMS has a demonstration project starting in 2020 that would do just that for plans that want to participate, alongside the VBID demonstration that's there as well. That includes some important flexibilities, particularly in the demonstration related to Part D.